editor-in-chief at Rebel News. Sheila, thank you so much for being with us today. It's great to have you.
Thank you. I'm glad that you can get a little bit of solace knowing that Canada sets the bar real low as far as politics go. But I appreciate your interest in this story about medical assistance in dying, which is the polite way of saying euthanizing the vulnerable and the sick, because it really has been a slippery slope, and we experienced it in real time from the introduction of this law in 2016 to where we are now on the precipice of being, when you call the suicide hotline in Canada, we're going to offer you suicide and not try to talk you out of it.
It is just astounding that this is seriously a real option and that this is happening. More than 10,000 Canadians were euthanized in 2021, which is 10 times more than when it was first legalized back in 2016. And this MAID law is now expanding in March. I mean, what has the general reaction been from Canadians? Are there seriously people who are okay with this?
There is a substantial, I think, extremist progressive portion of the Canadian population, I think similarly in the United States, who think that it is perfectly fine to euthanize the vulnerable. But even in progressive Canada, Canadians generally think that, and there has been some opinion polling done on this, that we shouldn't even be considering this, especially before we've offered mental health supports to these people and invested more in the mental health system. But I want to go back just a little bit to how we got here. So 2016, they legalized this law. Conservatives and social conservatives like myself were saying, this is a slippery slope. We can't go down this road. The government at the time said, look, this is for people whose death is imminent. And this is an act of compassion. Since then, we've entirely expanded this to include people with disabilities and disorders. So people are seeking medical assistance in dying when they are unsatisfied with the care that they're receiving for chronic illnesses. Now, look, this is Canada. We have subsidized healthcare, which means that you are chronically unsatisfied with the level of care that you're getting because it's rationed.
Yeah.
So people with diabetes are seeking medical assistance in dying. Elderly people who are not, they're just tired of living because they were in lockdown, people who are experiencing homelessness, people with eating disorders. Those are chronic illnesses that are considered under this law. And in some instances, they've even removed the 10-day wait period for this. And now we're opening it up to people who are experiencing acute mental illness. It's just an absolute atrocity.
It is an atrocity. It might even be an understatement to call it an atrocity because obviously mental health is on the decline. Everyone suffers from it in today's world, especially given all of the nonsense happening across the globe currently. I mean, mental health is just at an all-time low. And then for this to be one of the options after, just going to the doctor, I think I read that you just answer a series of questions, tick a couple boxes, and then so long as it gets approval from 2 different doctors, there's only 2 different checks that it has to go through, you can get the green light to go forward with this. I mean, this is mental in and of itself. How can anyone justify it? And is there any repercussion for the doctors? Are they held accountable at any point throughout this? I mean, how does that work?
No, nobody is being held accountable for offering this to people. Late last year, it came to light that our Veterans Affairs Ministry was offering medical assistance in dying to veterans who were in acute crisis, who were calling their Veterans Affairs caseworkers. I think it was somewhere between 6 and 9 cases that we know about. However, how would we ever know about the veterans who followed through with the advice of the angel of death on the other line?
For all our viewers asking where One America News is heading in the future, we would like to introduce you to OAN Live. OAN Live is the best way to stay up to date on all of the hard-hitting, straight-shooting, national and international headlines. And the best part is, OAN Live is only $4.99 per month. All the credible, honest, unbiased reporting One America News offers at a fraction of the cost of cable. Just go to OANN.com to easily sign up for OAN Live and stay informed.